In 1998, I founded BAYADAbililty, the very first in-home rehabilitative nursing program in the country. I created the BAYADAbililty program to better serve clients with injuries such as spinal cord injury and traumatic brain injury, and chronic illnesses such as ALS and MS. Our BAYADAbililty program enables us to provide the same high level of consistent care that people with catastrophic diagnoses most likely received in the hospital or rehabilitation center. We not only help provide a smooth and safe transition home, we also work to rehabilitate our clients to their highest functional level possible.
Although the extent of a disability from a spinal cord injury can vary, it is always a life-changing event, and it's often more than just the lack of physical ability. There are many complications that go along with such a traumatic injury. One of the most common is a urinary tract infection, or UTI, a leading cause of rehospitalizations. If you factor in that most individuals with a spinal cord injury have 2 or more UTIs each year, and 30% of patients are hospitalized at least once a year with an average stay of 22 days, a UTI becomes a very costly complication.
BAYADAbililty can help reduce the frequency of complications that can lead to unnecessary hospital readmissions. The payoff is huge. It preserves the quality of life for our clients and reduces healthcare costs for everyone involved, our clients, their families, and the payers.
Eric has not had a UTI ever since he's been injured, and that, they tell me, is totally unheard of. And I attribute that to the good care he gets.
Eric's nurses and home health aides, who have been trained to care for him through our BAYADAbililty program, are vigilant in providing care that is both attentive and proactive.
Well, I think it's really important that Eric has a nurse who is actually trained in specialized care. Because of the fact he has a spinal cord injury, there's a lot of secondary conditions that are associated with spinal cord injury that she knows what to look out for. She knows about dysreflexia. She knows about skin breakdown. She knows that, his temperature, Eric cannot regulate his temperature. And the level of care he's received at home is equal to what he was receiving in the hospital. The people that they sent were knowledgeable, trained on spinal cord injury.
They ensure his catheter is clean and unkinked, check his skin daily for breakdown, keep him hydrated for bowel management, and especially important, prevent him from getting overheated, which is one of his triggers for autonomic dysreflexia, a very serious complication. They pay close attention to the smallest details, like smoothing the wrinkles in his clothes to reduce the risk of skin irritation and breakdown.
They have the routine down to a science. It's kind of amazing to watch. It's like a well-oiled machine.
Prevention and early identification of a secondary condition often means the difference between staying healthy at home or having to go back to the hospital.
I do have high expectations for anyone who comes in here. I want to make sure that no shortcuts are taken. Eric's taken care of very well.